I am Dr. Puneet Agrawal. I am a laser and laparoscopic surgeon. I am creating today's video with Association of Surgeons of Agra, which is a unit of ASI India. Piles is a very common disease among males and females, among all persons. About 50% of all persons over the age of 50 at some time of his life suffer from piles. Pregnant ladies very commonly also develop piles. About 40% of pregnant ladies develop piles in postpartum time or in third trimester. It is very common 1 to 2 days after childbirth. And the most common anal diseases which pregnant ladies develop are piles and anal fissure. Piles are generally associated with constipation in pregnant ladies. The pregnant ladies which were suffered from any piles related diseases in her previous pregnancy or childbirth may also suffer from piles and fissure in his current disease. If the childbirth is done by instruments or by forceps, there are more chances of having or developing piles. If the birth weight of child is more than 3.8 kg, there are chances of developing piles. If the pregnant lady is of having habit of straining at the time of constipation, if she is taking more than 20 minutes for defecation, then there are very fair chances of developing piles. The piles disease can reactivate in pregnant lady or it can appear fresh in a lady. What are piles? Piles are anal cushions which are present at lower end of rectum and it consists of mucosa, thickened mucosa of rectum, and it contains blood vessels, connective tissue and smooth muscle fibers. When this connective tissue or cushions increase in size, piles form, and when they are abraded or lacerated, bleeding comes from the vessels from inside. And so these are the two presenting symptoms. Anal cushions or patient say that something is coming out during defecation, or the second most common symptom is bleeding. Generally, piles are painless, but when the blood supply of piles is less, then they are strangulated. Patient will complain of pain, and their blood vessels are thrombosed. When the blood clots inside these piles, the patient will complain of pain. Now I will discuss the etiology of piles in pregnant ladies. And the most important first factor is growing uterus. With the growing uterus, there is increase in abdominal pressure. Plus, the growing uterus mechanically compress the lower part of the rectum, inferior vena cava, veins, and they also compress the portal veins. And these, because of this compression, because of this increased pressure, there is venous stasis. And because of this stasis, blood circulation to the internal and external sphincter is decreased. And when blood circulation is decreased, pile will start developing. Number two, the circulating blood volume. In pregnancy, circulating blood volume is increased from 25% to 40%, up to 40%. And this causes vascular dilatation. All the veins around the anus and rectum are dilated. Blood is pooled there, and this is the cause of dilatation of cushions. Number 3, hormonal factor. Because of the increase in progesterone, and progesterone relaxes all the muscles of the body. It also relaxes the veins of the rectum and anal canal, and because of this, these cushions are more prone to swelling. Childbirth also plays a risk factor for pelvic floor dysfunction, and because of this pelvic floor dysfunction, patient develop constipation. And Kegel exercise is a very good option to correct pelvic floor dysfunction, about which I will tell later in this video. The other factors are obesity, sedentary lifestyle, and diarrhea. These are all risk factors which can precipitate piles in a pregnant ladies. After first pregnancy, about 38% of females develop piles. This is so common. Other risk factors are prolonged birth time if it is more than 12 hours, prolonged second stage of labor, spontaneous childbirth, prolonged pregnancy if the pregnancy is more than 40 weeks, patient may develop piles. Now I will discuss about constipation, which is the main etiological factor and which is the main etiological factor which we can correct. We can't do anything about other factors, but we can correct constipation. We can modify the factors which precipitate constipations. About 40% of pregnant ladies suffer from constipation, and that's why piles are so common in pregnant ladies. And the number one factor is dietary factors. Iron supplements are advised by the obstetricians to their patients, and this iron is a very common cause of constipation. Number two, patient's intake of sufficient water is decreased because of the nausea and vomiting during pregnancy, and this decreased consumption of oral fluids leads to constipation. The second is behavioral changes. During pregnancy, the physical activity of pregnant lady is reduced. There is physical and social stress. That's why patient may develop constipation. Third is humoral changes. Progesterone level affect or it slows the bowel movements. The motilin also reduces the motility of bowels. Other causes are growing uterus due to pregnancy, which compresses the rectum and causes constipation. Sometimes painful piles also develop constipation, and sometimes patient is habitual for constipation. Now, what are the symptoms? The main symptoms, as I told you, is the lumpy feeling. Patient complains of lumps around anus, which comes out during defecation. It may go inside itself, or patient has to push by hand. And sometimes in grade 4, the piles are present outside only, they don't go inside. And this, if these piles are abraded, then there is bleeding. Other complaints are patient will complains of discomfort, patient may complain of itching, patient may complain of burning, patient also complain of mucus discharge from anus. The epithelium which is covering the piles start producing excessive mucus, and patient will complain of mucus in the anus. And what about treatment? The treatment is conservative in most of the time till the lactation, childbirth and lactation is over. Only after this we advise proper treatment. Otherwise, it is better to treat piles with conservative treatments. And after when the lactation is finished, then we can have final treatment. I have developed my 5F scheme. So I advise all the doctors and patients to focus on my 5F scheme, and this is very good to prevent piles in patient. And the 5Fs are: number 1 fiber, number 2 fluid, number 3 fitness, number 4 flush habits, and number 5 don't be fussy. I will discuss now number 1 point fiber. A pregnant lady should have 25 to 30 grams of fiber per day. And fibers are present in most of the vegetables and most of the fruits. It is better to take complete fruit, not the juice, because juice, major part of the fibers are lost. You can take guava, you can take pears, apples, oranges, raspberry, strawberries. Most of the fruits are having very good amount of fibers. Prunes are also having very good amount of fiber. And you can have wheat with it covering, full wheat. You can have brown rice. The coverings of whole cereals are not should not be discarded. You can take whole wheat on whole cereals. Then you can take lentils. All lentils should be taken with its covering. You can have beans as rajma, soya beans, moongfalis, peanuts, chickpeas. All this you can take, but with its coverings. Milk, meat, red meat, sugars. There are no fiber in these items. So beware of these items. The number two, you should not take. You should take about 3 to 4 liters of fluid with your meal within whole day. You should take 3 to 4 glasses of water first thing, lukewarm water first thing in the morning. And water should be take while you are sitting, and take water sip by sip. You can, in place of water, you can take coconut water, you may have soups, you may have fruit juices, etc. etc. But your total fluid should be 3 to 4 liters. It may be more in summer weathers. Now comes the third F, that is fitness. You should not have sedentary lifestyle. When you lie on left of your side, but don't stand or sit for more time. Keep changing your position and keep changing your side. Keep moving. Movement is very good for your body. Wear loose clothes. Your panties and the clothes should be loose. It should not be very tight because they decrease the blood return of the from the lower part of the body. Say no to sedentary lifestyle. Do exercise and yoga as prescribed by your obstetrician. Perform Kegel exercise. Kegel exercise are very important exercise, and if there is any pelvic floor dysfunction, it should be corrected by Kegel exercise. For Kegel exercise, you should sit comfortably on a chair or any place, and then you try to tight your muscles of lower part of your abdomen around rectum and around your urethra. Tight the muscles of this part for 5 to 10 seconds and then relax. Do this exercise for about 10-15 times, 3 times a day. And now my 4F is flush habits. Don't strain at the time of defecation. Do not strain. Don't sit for long over the potty. Whenever you have feel urge for potty, go and then stand up quickly. Don't sit up there for more than 10 to 15 minutes. Always answer the call when you are having the feeling of defecation. You can perform sitz bath. Sitz bath is very good for piles. Sit in a tub with lukewarm water and sit in this tub with your buttocks inside for 5 to 10 minutes. This is a good this is very good for your piles and to relieve the tension in the sphincters. And the number 5A is don't be fussy, be happy. Pregnancy is not a disease, it is a physiological condition. And if you are happy, everything will be passed very easily. So this all about what you can do. In spite of this, if the treatment is required, we can give flavonoids and tropical ointments which can be prescribed by your doctor. Don't take any medicine from internet. Just go to your doctor, your obstetrician or an proctologist or come to me for advice. But don't take any medicine from internet without a prescription. If treatment is must, then minimally invasive procedures can be done, which is rubber band ligation, sclerotherapy, or infrared ligation. And surgery or laser therapy can be possible after the childbirth or preferably if lactation period is over. I have described my full knowledge in this talk, and I will be happy if you have anything to ask from me. I can answer all your queries on WhatsApp. My WhatsApp number is 98371 44287. You can also write me on my emails. Thank you very much for seeing and listening to me so patiently. Thank you.